Before using this program, taking my medication was very challenging for me.
I went probably 6 months to a year missing a lot of my meds.
I forgot it a lot.
I used to use, those little containers where you put your pills in.
On a weekly basis, I was missing at least 4 dosages.
Now, I never miss my meds anymore.
My refills just show up at my doorstep and I don't have to think about that.
I am getting all my meds on time.
It's so friendly, so user-friendly.
And it's like having your doctor and your pharmacist and everybody right there.
My diabetes is very consistent now. And even my doctor had said that, it's the best he's ever seen it.
My name is Teresa Petrie. I'm a pharmacist, and I've been practicing pharmacy for over 25 years in a number of different settings, in the community, in hospital, as well as in senior care and long-term care. Connected technology has truly impacted so many of my patients. Those living with diabetes, when they start using this program for medication adherence and monitoring, oftentimes within a week, they'll come to me and say, my blood sugar has stabilized. Not only that, but they're telling me that they feel better because they're taking their medications not only every day as prescribed, but actually at the same time every day, which makes the medication so much more effective, works with your own body's biorhythms to make sure that the medications are doing what they're supposed to.
This medication reminder program makes sure you get the right medication at the right time. As a part of the program, you're set up with a connected medication dispensing device that reminds you when to take your medications and dispenses it for you. With this full service program, the pharmacy handles everything for you. They do comprehensive medication reviews, set up and track dose times, and sort and deliver your medications right to your door. Your device communicates with your local pharmacy in real time, so they can help track your medication and make sure you're not running into any issues. It can also be set up to communicate with family members or caregivers if you wish. This program also allows you to do video calls with your pharmacist or physician in the comfort of your own home. This program is for anyone who's on new medications, complex medications, or for anyone who just wants to make their medication routine easier.
The World Health Organization defines medication adherence as people taking their medications on time 80% of the time. Now that sounds easier said than done. In reality, only half of people actually follow their treatment guidelines as prescribed. There are many reasons why people have difficulty taking their medications as prescribed. One of the biggest challenges in diabetes management is the number of medications that my patients are taking. Typically, it's 5 or 6 medications at least, just to manage their diabetes and prevent negative effects. When 1 in 3 Canadians are living with diabetes, it's inevitable that many have other chronic diseases as well that are managed by medications. And of course, medications can be pills, a combination of pills and injections, and there may be other things layered on, inhalers and so on. So now we're getting to the point where people are juggling multiple medications a day, multiple doses a day, going from once a day to 2 or 3 times daily or even more frequently. And it's very easy for people, they're busy, they're managing their lives, they're helping their loved ones with other issues, they're taking care of children, and all of a sudden they're missing that middle dose in the day. And so very often then they're not taking their medications as many times a day as they're prescribed. They're not taking them at the same time every day, which is ideal. And, there are other factors too. People are afraid of side effects, or when they develop side effects, they may just stop taking something without consulting their pharmacist or physician. Maybe the medication doesn't seem to be working for them, and then they are not motivated to take it on time. So there are really a number of complex factors. Those are just some of the ones that I've mentioned. Medication adherence is particularly important for patients living with type 2 diabetes, because they need to not only keep their blood sugar stable on a day-to-day basis so they stay out of hospital, but also keep their blood sugar stable over the long run to help prevent organ damage like heart disease, kidney disease, or blindness. The good news is we know that with healthy lifestyles, so a combination of nutrition, exercise, and taking your medications on time can really help prevent those long-term side effects. The pharmacist's role in diabetes management is truly critical. Pharmacists can do so many things to help patients take their medications on time, feel comfortable about taking them. Obviously, when they fill prescriptions, they check for interactions and make sure that those medications are compatible with other medications. Over time, we've been able to help patients monitor the outcome or the effects of that medication by monitoring blood sugar, by asking patients to document their blood sugars and reviewing them over time, or doing blood pressure checks from time to time. But today it's even more exciting because with connected technologies that actually allow the pharmacist in real time to be able to monitor patients taking their medications on time and also check on the effects of those medications. There are actually Bluetooth devices that can connect in and show the pharmacist on a portal what the blood pressure is, what the blood sugar is in real time. And that gives the pharmacist amazing tools to be able to do a full workup of the patient and how the medications are working for that patient at any given time. With connected technologies, we can see all the medications at once and we can see the full picture. And not just with the Bluetooth vitals, but with using telehealth to actually interact with the patient on a very regular basis at any given time. There are many connected technologies that I've seen used successfully recently. An automated medication dispenser that ensures that patients take their medications, have them available and take them right at the time that they're due, and have that connected piece where the pharmacist can see what their medication adherence is in real time. Also, loved ones can have access to that through an app where they can actually look and see that their parent or loved one has in fact taken their medication when it's due. Provides a great deal of relief for caregivers. I'd like to thank Diabetes Canada for all the wonderful work you do and for giving us the opportunity to talk about connected technologies and pharmacists helping patients with diabetes live better lives.